Hi and welcome to In Focus. I'm Loretta Boniti. There are a record number of prescription drug shortages in our country, with more than 320 shortages in just the first quarter of 2024. In North Carolina, this is affecting families in need of these drugs and the healthcare providers trying to help.
If I keep these things alive, it also helps me keep myself moving and grooving.
One of the first things you'll probably notice in Charlie Roby's home is all of his plants.
It helps keep me in check, because if I'm taking care of my plants, I'm probably taking care of myself.
Roby has ADHD.
I would say, what was your question again?
It's a diagnosis he didn't get until he was nearly an adult, but it is a disorder that has long affected his everyday life.
Through high school and college, I kind of realized that, there might be something more than just me having a big mouth.
These days, he goes to therapy, has his quote-unquote homework, like his horticulture hobby.
Trying out the Adderall at first, I noticed small amounts of concentration getting better, or, focusing on certain tasks that I probably didn't want to do, kind of day-to-day stuff.
A welcome relief as he continues to calm his thoughts and focus his actions.
Just kind of make my river of thoughts straight and narrow.
Adderall is a common medication for those with ADHD to help concentrate and lessen anxiety, which is why it has been all the more frustrating for Roby to feel the effects of the ongoing drug shortages in our country.
I know they're probably trying their best, and so am I, but there's no repercussions for them or whoever it may be. For me, though, I might lose my job. And I'm not saying I rely on my Adderall, and I'm not saying that I need it, but I signed up for whatever it may be. I signed up to better myself, and now they are telling me how to better myself. But what if, one of the ingredients is missing? What do I do?
The mother called and just has some concerns about ADHD as well as possible autism diagnosis.
At Family Psychiatry Practice and Associates in Cary, cases like Roby's are something they see every day.
If they are having symptoms that make it difficult for them to focus in class, or perhaps they are having difficulty paying attention to the teacher, if their teacher has commented on this and their parents also see it at home, then I might be more inclined to start a medication.
Medical director Dr. Tian Duxway says medication is not often the first step when he sees a new patient, but many times it is what ultimately helps someone once they have that ADHD diagnosis.
Although these stimulant medications often work the same day and we'll see a difference within the first week, the long-term benefit is that they will no longer maybe be seen as the class clown, or teachers will not view them as, oh, this is the problem student, and that's a huge boost in their confidence overall in their development.
In its most recent report to Congress, the Food and Drug Administration says drug shortages are a, quote, significant public health issue. Statistics by the Centers for Disease Control estimate over 10% of all children have ADHD, and of those kids with a diagnosis, 4 in 10 have anxiety, and over 40% have behavior or conduct problems. Drugs are often part of the therapy, but shortages of those medications have been in effect for well over a year. Duxway says it's not just as simple as prescribing a different drug when this happens.
I'm comfortable with a variety of ADHD medications, whether that's a methylphenidate-based medication, whether that's an Adderall or Adderall derivative type of medication. I can see the pros and cons of each, and I definitely want to consider those, and I discuss those with parents. I do know that different medications have a different length of coverage throughout their day, that some might be better for hyperactivity and impulsivity versus inattention. I consider and weigh all of these different considerations first before sending the alternative medication.
I would imagine that this is already a stressful time for the families, and now you're adding in, okay, now you have to figure out where to get this medicine from.
This leads to a lot of frustration for families and for parents. They often are busy, they often are working during the open hours of their pharmacy. We like to be very flexible with these parents. We understand and empathize that they are busy, they are worried about their child. We want to make it as easy as possible for them.
The causes of the shortage are multifold. First, more people were diagnosed with ADHD during the pandemic, so there is simply more demand for the drugs. And also, manufacturers have faced natural disasters and quality issues, causing production shortages. And there have been limits by the DEA on how much of these medications can be produced. This is not something that is just felt in the mental health field, but some cancer drugs, diabetes medications, or RSV-related medication for kids have all been in shortages in recent years. Dukesway points out that the shortage, coupled with the cost differentials, can be overwhelming and complicated to figure out.
Insurance companies will not want to pay for 2 tablets or capsules of the medication. They would rather pay for 1 capsule or 1 tablet of that medication per day. Unfortunately, some of these formulations require 2 or more administrations or capsules per day. Working with parents to overcome these frustrations, that's just part of my job, and it's very rewarding.
Roby, meanwhile, is continuing his homework, finding his outlets outside of medication to help control his ADHD.
If I exercise, take care of my body, if I take care of my plants, like I said, the rest usually takes care of itself.
He says he believes his ADHD is under control today. A big part of that is the medicine, but the medicine has also helped him find his other outlets to lead a very normal, happy life. This shortage is particularly impacting folks with ADHD. We dig into what it means and how those in healthcare are working on the problem, coming up next.